This is a video summary. Be sure that you first read, understand, and follow the printed full instructions for use that came with your Bydureon Exenatide Extended Release for Injectable Suspension Pen. Please see important safety information, including boxed warning about possible thyroid tumors, including thyroid cancer, and indication included in this video. How to use your Bydureon pen. Take your pen out of the refrigerator and let it warm up for 15 minutes. Don't forget to wash your hands and wipe the injection area with an alcohol swab before starting. Look at the liquid in the window. It should be clear and free of particles. While pushing down, twist the cover needle into the pen until it's tight. Don't remove the plastic cover yet. Twist the knob on the bottom of the pen. Stop when you hear the click and the green label disappears. Tap the pen firmly against the palm of your hand to mix the medicine. Rotate the pen every 10 taps. You may need to tap 80 times or more. Look through both sides of the window to make sure the medicine is well mixed. The solution should be uniformly cloudy with no clumps. If so, you are ready to inject. If not, tap longer and more firmly. To get your full dose, Bydureon must be mixed well. Once the medicine is mixed, twist the knob on the bottom of the pen until the orange label disappears and the injection button is released. Pull the needle cover straight off. Insert the needle into the skin and press the injection button until you hear a click. Hold the button down for 10 seconds to get your full dose. Properly dispose of your pen with the needle attached in an FDA-approved sharps container immediately after injecting. Congratulations! You've just learned how to inject Bydureon. What is Bydureon Pen Exenatide Extended Release for Injectable Suspension? Bydureon is an injectable prescription medicine that may improve blood sugar, glucose, in adults with type 2 diabetes mellitus and should be used along with diet and exercise. Bydureon is not recommended as the first medication to treat diabetes. Bydureon is a long-acting form of the medication in Byetta exenatide injection, so both drugs should not be used together. Bydureon is not a substitute for insulin and has not been studied in combination with insulin. Bydureon is not for people with type 1 diabetes or people with diabetic ketoacidosis, a condition caused by very high blood sugar. Bydureon is not recommended for use in children. It is not known if Bydureon is safe and effective in people with a history of pancreatitis or severe kidney problems. Important safety information for Bydureon pen. Possible thyroid tumors including cancer. In animal studies, Bydureon caused rats to develop tumors of the thyroid gland. Some of these tumors were cancer. It is not known if Bydureon causes thyroid tumors or a type of thyroid cancer called medullary thyroid cancer, MTC, in people. Do not use Bydureon if you or any of your family members have MTC or if you have multiple endocrine neoplasia syndrome type 2. While using Bydureon, tell your healthcare provider if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or shortness of breath. These may be symptoms of thyroid cancer. Do not use Bydureon if you have had an allergic reaction to exenatide or any of the other ingredients in Bydureon. Severe allergic reactions can happen with Bydureon. Symptoms of a severe allergic reaction to Bydureon are severe rash or itching, swelling of your face, lips, and throat that may cause difficulty breathing or swallowing, feeling faint or dizzy, and very rapid heartbeat. If you have any symptoms of a severe allergic reaction, stop using Bydureon and call your healthcare provider right away. Inflammation of the pancreas, pancreatitis, may happen, which may be severe and lead to death. Before using Bydureon, tell your healthcare provider if you have had pancreatitis, stones in your gallbladder, gallstones, a history of alcoholism, or high blood triglyceride levels. Stop using Bydureon and call your healthcare provider right away if you have pain in your stomach area, abdomen, that is severe and will not go away, occurs with or without vomiting, or is felt going from your stomach area through to your back. These may be symptoms of pancreatitis. Your risk for getting low blood sugar, hypoglycemia, is higher if you use Bidurian with another medicine that can cause low blood sugar, such as a sulfonylurea. The dose of your sulfonylurea may need to be lowered while you use Bidurian. Signs and symptoms of low blood sugar may include shakiness, headache, drowsiness, weakness, dizziness, confusion, irritability, hunger, fast heartbeat, sweating, and feeling jittery. Tell your healthcare provider if you have or had kidney problems or a kidney transplant. Bidurian may cause nausea, vomiting, or diarrhea, leading to loss of fluids, dehydration. Dehydration may cause kidney failure. This can happen in people who have never had kidney problems before. Call your healthcare provider right away if you have nausea, vomiting, or diarrhea that will not go away, or if you cannot drink liquids. Tell your healthcare provider if you have severe problems with your stomach, such as delayed emptying of your stomach, gastroparesis, or problems with digesting food. Serious injection site reactions, with or without bumps, nodules, have happened in some people who use Bidurian. Some of these injection site reactions have required surgical intervention. Call your healthcare provider right away if you have severe pain, swelling, blisters, an open wound, or a dark scab at your injection site. The most common side effects with Bidurian include nausea, diarrhea, headache, vomiting, constipation, itching at injection site, a small bump, nodule at the injection site, and indigestion. Nausea most commonly happens when first starting Bidurian, but may become less over time. Before using Bidurian, tell your doctor about all the medicines you take, as taking them with Bidurian may affect how each medicine works. Tell your healthcare provider if you take other diabetes medicines, especially insulin, or a sulfonylurea or warfarin sodium, Coumadin or Jantoven. Tell your healthcare provider if you are pregnant or plan to become pregnant. It is not known if Bidurian will harm your unborn baby. Talk to your healthcare provider first if you are breastfeeding or plan to breastfeed. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see the accompanying medication guide and U.S. full prescribing information for Bidurian Pen 2 mg, including boxed warning about possible thyroid tumors, including thyroid cancer, by clicking on the links next to this video.